In the case of Chad, if I was using person-centered therapy, I would really want to create a climate of non-judgmentalness, and I would do this by being genuine and showing empathy and really listening to the client's story. I would want to really promote self-exploration for him, that he could explore really his real self and his ideal self. As he mentioned, he doesn't like his personality the way it is, or he mentioned that people don't like his personality, so that's something he wants to develop in. So I'd really encourage him to explore those areas. However, I did not choose his approach, as he seemed to appreciate a more directive approach that's found in CBT and Alderian therapy. Within CBT, therapy is oriented towards cognition and behavior, as cognitions shape the way we think and feel. So within the therapy session with Chad, I would really stress the role of thinking, of questioning, of doing and redoing. I would really hope to promote a learning process of acquiring new skills and practicing those skills in real life situations. So that would be some homework that would be given throughout the therapy process. Practicing these new skills, I would also want to help learn new ways of thinking and more effective ways of coping. Rational emotive imagery may be useful, as it would explore his fear. And as he mentioned in the intake session, one of his fears is of losing all his friends. He mentioned that that's why he came to counseling, because he genuinely does care for his friends, but his friends tell him that he's a jerk. So we would really work on his behavior and how he views his behavior. However, I did not choose CBT as I felt more in-depth exploration of his family needed to be present, not just dealing with the presenting problem. I feel a family systems approach or an Alderian approach would be more suited to really explore the family dynamics. I was using family systems theory. I would focus on the communication patterns of the family. I would really want to explore the interaction patterns from generation to generation. Chad mentioned that he has a fear of becoming or following in his father's footsteps and becoming this jerk that his friends, quote unquote, say. And so I would really want to explore if that is a pattern throughout the family. Also, I think constructing a genogram would really help with addressing and identifying the interaction patterns within the family. However, as his family would not be able to attend due to location reasons, and his father is estranged, so he wouldn't be able to attend, I chose not to use this type of therapy. Chad has come into counseling to really seek help to change his behaviors. He doesn't like being a jerk. He eventually comes to see that his behaviors are what his friends classify as being a jerk. And so he really wants to grow and develop in that area. So that's the presenting problem, and a lot of that stems from past abandonment issues with his father, and really feelings of inferiority and low self-worth. I chose to do integrative perspective in therapy, as every client is different and has their own unique needs, and I really felt by limiting my therapy to just one stylistic approach, it would really hinder Chad from exploring all the areas he needed to, and to really challenging himself and growing in his life. I use person-centered therapy to create an atmosphere of non-judgmentalness where Chad could feel open to self-explore and really explore his ideal self and his real self, as there seemed to be some discrepancy there. He wanted to be a better person, not a jerk, and yet he was doing that, and that's why he came in. However, I was a bit limited in my approach just using person-centered therapy, as it's less directive. And so I also incorporated Adlerian therapy, as it let him really explore his past and the family dynamics through like a family constellation, and really explore his relationship with his dad and how that had impacted him and his personality. The basic philosophy of Adlerian therapy is to really promote the individual's capabilities within his community. And as Chad wanted to grow and improve his relationships with his friends, I really felt Adlerian was also best suited, as it allowed him to really challenge himself and grow in these areas. Also, one of the key techniques of Adlerian therapy is encouragement. So not only did I use unconditional positive regard from a person-centered perspective, but I also used encouragement, encouraging him in his openness in sharing about his past and about his challenging behavior that he is looking to develop in. Nice to see you back, Chad.
Nice to see you again, Doctor.
Thank you. Okay, so how have you been?
I've been good.
Yeah?
Like I said in the last session, Jason Chadlock is always fun.
Well, I'm glad to hear that. You know, I wanted to thank you for being so open and transparent last session. It really shows me your commitment to the therapy and commitment to really challenging yourself to grow.
You're welcome, Doctor.
No problem. Okay, so just picking up from last week, you talked a lot about this issue of being perceived as a jerk, and so I wanted to explore that more. But I wanted to start off with more about your family relationship. You said your relationship with your parents is non-existent due to their location.
Mm-hmm.
So I wanted to kind of find out a bit more about how your relationship with your dad is and how it was previous.
Well, I mean, he was always kind of around. I mainly just remember him going to work, coming back for dinner, and I mean, we played catch once.
Yeah.
But I think he was just trying to fit into the suburban lifestyle.
Okay.
That was laid out for him. Yeah.
Okay. And so, So maybe you fast forward into when he left. Can you tell me more about how you felt?
Abandoned.
Yeah. And what were your feelings towards him?
Bitterness.
Yeah.
He made me feel inferior.
Um,
Like I didn't matter.
so we were talking about the main issue being that people feel you're a jerk. And obviously you care about these opinions or you wouldn't be here.
I guess you could say that.
Yeah. And you talked about how a lot of times you do these things and in a way you feel inferior. So I just want to explore maybe those feelings more. Can you describe the kind of situations where you would feel inferior and tell me what you would do?
Well, I mean, the more I feel inferior and less of a man, the more I act out more. Which is why I do the things that I do. I look out for number one, like not taking my coworkers to their destination. I mean, I was looking out for number one.
Okay, so would you see that as kind of a way to cope? Like, almost like a coping mechanism? As looking out for number one, as maybe almost being a jerk to kind of cope with the feelings?
I guess so. I mean, like, my father was never there for me. He never took care of me, so why should I take care of anyone else?
Yeah.
You know, I mean, it just, I mean, because he's not there for me, I'm giving them a life lesson.
Yeah.
That not everyone's going to be there for you, to hold your hand and walk you through the valley of shadow of death.
And I hear you saying that, but also I hear you saying that you want to change that because you want these people to not think you're a jerk, because I guess in a way you do care about them. Is that accurate?
Right, because my biggest fear, Doc, if I'm afraid of anything, is one thing.
What is that?
Okay, it's spiders and one thing, but don't tell anyone that.
Okay, don't worry, everything's confidential.
Is that, besides spiders, I mean, the fear that I'm going to grow up like my father. So looking back in retrospect, maybe I should have given them a run. I mean, not abandoning them, like my father has abandoned me.
Well, I'm really glad to hear that, that kind of realization in that area you're really going to try and grow in. I'm really proud of you for that. So maybe next session we can talk more about your earliest memories and kind of explore more of your family situation. Okay, thank you for coming. I'll see you next week. I'm glad you came, Chad.
Thank you for having me.
What a firm handshake.
Well, you know, I do work out, like I said.